Hey, Anatomy students, Mr. Yance. Hope things are going well. Um, we're going to start a new chapter today on the heart, which fits right in with our dissection we're going to do. We're going to do a heart dissection. Actually, that's a picture of the heart dissection as you see on my screen. Um, I want to kind of skip ahead a little bit here in notes and so that you see. We'll come back to some of these pictures. So a little introduction today. The heart is roughly about the size of your closed fist is kind of what it looks like. A little bit bigger than that, but not much. It's located just behind the sternum, which is your breastbone right here, right? We're going to talk a lot about that with CPR training coming up here. And it goes from a little bit of previous knowledge from about the second to the sixth rib. Now, understand this is really important later, too. 2/3 of its mass is on the left side, your left, and 1/3 is on the right. And it sits on that fifth to eighth bodies of the vertebrae in your back. Okay, so that's what allows us to do, well, you'll see it down here, that positioning between the sternum, which has got some cartilage in it, and the backside, which has vertebrae, which are solid. That's why we can manually compress the heart in CPR and keep blood flowing to the brain. That's called rhythmic compression, and that is what allows us to do CPR. If we didn't have that anatomy feature of the sternum, which has got cartilaginous ribs hooked to it, has some give to it, and the vertebrae on the back, we wouldn't be able to do CPR. So we're very thankful that we have those physical structures. And we'll talk more about that when we get into the CPR unit, which is going to be right after this. So I always like to do CPR right after I get done teaching and dissecting the heart. Okay. The lower border kind of comes to a blunt point. That's called the apex. And that's where, when you go get a physical done at the doctor's office and he's moving that cold stethoscope all over your chest, he's listening for that apical beat. That's right there where the heart comes down. That's between the fifth and sixth rib down at the bottom. So when you look at a heart, let's put that heart back up there. Here you go. We can look at this one. You can see where it comes to this nice little point at the bottom. That's where that apical, that ventricle, which is pushing blood to the entire rest of your body at a high pressure. That's where we're going to pick up that apical beat. All right, which is really important when doctors are doing physicals and trying to see if you got an irregular heartbeat or whatever. Okay, the upper border lies just below the second rib, and why is that important? Why do we care if it's between the second rib and the sixth rib or whatever? Because the borders are really important. If you have an enlarged heart, that makes it work harder than it has to. And people sometimes are born with enlarged hearts, and that is something that doctors pay close attention to. So, I just went through all that. You guys all know I just went through a lot of heart testing, a treadmill. I had a ultrasound, I had an MRI, they did everything. Went in and had heart catheterization. And that's one thing they look for. Is your heart within those borders? Because that's where a heart's supposed to be, is within those borders, and most people it is. But there are people sometimes that have an enlarged heart and have to have a heart transplant. Okay. There's a great video that kind of goes through enlarged hearts and the consequences. Not going to do that right now. You guys can watch that later. Okay. So your age, your body type, the state of contraction, all that's going to influence your heart size. Those of you out there that are what I call height challenged, if you are short, don't worry. Tall, thin people generally have elongated hearts. Short, stocky people have a wide transverse heart. Look at the difference between these two hearts taken out of a short person and someone who's about 6'11". The problem is, short people, you'll live longer because this heart doesn't have to work as hard as this heart. And I've got lots of studies on that. So there you go. People always complain about being short. Short people live long. We actually had a lady in our church that turned 100, and she was about 5'3", and really tiny, and made sense. I mean, your heart has so many beats, and that's why you want to worry about heart rhythm and keep your heart rate at the lowest possible level you can keep it. Okay, and finally, I'll kind of wrap up with this. I just kind of want to introduce some notes today. About 1/130th of the total body weight at birth is your heart, but look, as an adult, it's 1/300th of your total body weight. So obviously, it'll become more proportional as you get older. You usually get a full-size heart between puberty and 25. 2021 is usually a good average. It does weigh more in a male because we're a little bit bigger and a little heavier muscle, a little bigger frame. About 310 grams in a male and about 225 grams in a female. And if you look at it, it's not proportional. It's about 12 centimeters long, so it's longer than anything. About 9 centimeters wide and about 6 centimeters deep because it has to fit between the sternum and the vertebrae on your back. All right. So I just kind of want to give you a little general background on the shape and size and things like that. We will dissect the heart. We'll do that coming up here, and you'll get a little better idea. I want to go through all the chambers and the different blood vessels and give you a little background knowledge the next couple days, and then maybe towards the end of the week, we'll dissect the heart, and you'll see what it actually looks like. All right? Hopefully that makes sense to all of you. As always, please ask questions if you shoot me an email if something doesn't make sense. Okay? Hey, have a great day. We'll talk to you later. See you. Bye.